Hello, everyone. I'm Dr. Renee Mehrra, and welcome to TV Asia viewers and all those on social media. Today, we're going to be talking on the Ayurveda perspective on COVID-19, which has completely consumed us all. And it's become a big challenge because it's a novel virus, and it keeps on duplicating and mutating. They're talking of different strains of the virus in different countries. The symptoms are different many times. So it kind of has a big challenge in terms of prevention, how to prevent, how to do early intervention. But from the Ayurveda perspective, there are many immunity boosters in diet, healthy lifestyle, and what Ayurveda, from our Ayurveda text, talk about viruses in general, and what we can do to keep ourselves healthy and have a strong immune system for early detection and early intervention, because that's where Ayurveda really comes in. It's a science of longevity and what our texts say, and they are still relevant even now at this point of time. So joining us, we have a very well-known Ayurveda practitioner from Citrus Hills, Florida, Dr. Aparna Bapat. She's been practicing Ayurveda for over 22 years. She's on the faculty of many Ayurveda colleges in the United States. She's coming up with a new book on the experiences of her patients. And she specializes in Nari Vigyan, which is false diagnosis, Panchakarma, herbs, and nutritious diet from the Ayurveda point of view. Thank you so much, Dr. Aparna Bapat, for joining us today, TV Asia and social media. So tell us, we know that there are 5 elements: it's living and non-living matter, and Ayurveda looks at them, and all of them have 5 elements. We're talking earth, water, air, ether, and how does Ayurveda look at viruses from the Chartika Sushnita text and the ancient text that talked about viruses during those days?
Okay, so namaste, and I'm very thankful to Renee, and thank you all the viewers. I would like to share whatever I've learned through my practice and through this huge, vast knowledge of Ayurveda over so many years. And Ayurveda is a really very holistic science. So it encompasses everything, every form of life, not just human life and human health. But Ayurveda tries to understand everything that is life, or that helps to live a very fulfilled life. So let's look at the basic of Ayurveda. Ayurveda talks about the 5-element theory, which is the theory of Panchamahabhutas. So everything in the universe is made up of 5 elements. And if we say everything, that means all the non-living objects, all the living organisms, everything that we interact with, like plant kingdom, animal kingdom, microbes, protozoa, all the single cellular amoeba, bacteria, viruses. So yes, in Ayurvedic times, they had a complete understanding of these sukshma or invisible forms or entities of life. Even when the microscopes were not invented, they had a full description of what these invisible entities are and how to deal with them. So if we talk about bacteria and viruses, they were kind of classified just like in modern medicine. We classify them as a DNA type of virus or any living organisms, and then RNA type of virus, which is primarily a protein molecule. And you can understand how well advanced the whole system was by so many aspects, not just the description of bacteria and viruses, but also related to how to deal with pandemics, how to even stop them to begin with, and then how to keep all the community very healthy, and in case if some such infection or infectious disease spreads, then how to handle it with various antiviral herbs and herbomineral compounds. So it's a very intriguing thing that this was already very well known, very well documented. So looking at the types of viruses that we have, this Vishanu, which is the RNA type of virus that we have, that can enter into the human cell, into the host cell, and create a havoc. We have already seen so many people all over the world suffering from it. And so in Ayurveda, one of the ways to tackle it or to handle it was to follow a healthy routine. So rather than getting ready for it last minute, it's something that we need to cultivate as a habit, as a lifestyle, especially in the times when the two seasons are changing. We can see that these epidemics are at a high peak. Like we always call something like flu season, right? Or a seasonal allergy or something like that. So these kind of epidemics are very prevalent whenever the seasons are changing from spring to summer or summer to fall. So we have to do certain protocols. There are in the Vedas, they have described something called the yajnas or fire ceremonies, where we worship the Agni, the fire, which is a very fundamental part of our being. And because we are made up of 5 elements, the fire element within us lives within us in the form of a Agni, something that the energy that helps to digest, transform, metabolize, and discard anything that is of no use to us. So this entire system of digestion and metabolism is very crucial, and not just as a physical level, but also at a cellular level. This keeps on happening all the time. And as strong Agni we have, the strong Ojas, or the built up of immunity, our body will have. And whenever there is lack of immunity and lack of Ojas and lack of Agni, there will be formation of Am. So Am is basically a substance or a systemic dysfunction of weak Agni. And at a cellular level, if that happens, then anything can attack that cell. So the cell will not have the intelligence to discriminate or to bring things in. Whatever are harmful, it can bring it in. And we have two types of Agni in the cell, the Pilu Agni and the Pitara Agni in the cytoplasm and in the nucleus. And those can be, when they are depleted, because the generalized body Agni and Ojas is depleted, then the cell can be an easy victim for any of these Vishanus or potentially toxic substances to enter into the cell and start destroying the host. We have seen that there's so many hazardous symptoms that people have been suffering from. So to handle these at the last minute in the crisis, Ayurveda also has antiviral substances. Ayurveda also has herbo-mineral compounds. So these herbo-mineral compounds or bhasmas are not very much in use right now in India. And also in the United States, it's not legally allowed to bring in any kind of bhasma preparation. So we definitely cannot use them.
I wanted to interrupt you here, because we know it's a Vishanu virus and it's RNA type. It's aggressive, it's toxic, it's poisonous. So right. Before it enters the host cell, we're looking at preventative measures right now. But when we talk about bhasmas, Aparna ji, we're talking about they're not FDA approved, so especially in the Western world, we cannot bring them here. And I guess they have to do some clinical trials on this, even though it's been believed that they can be very effective, especially Yasad Basma, Zinc Basma is very effective. But since we do not have any FDA approval on this, what is then recommended?
So I did want to mention about the bhasmas just because I want to share the information that Ayurveda has antiviral medications, which are the herbo-mineral bhasma preparations. So just definitely want to share that. Now, whenever the clinical trials will happen and FDA can clear it at whatever time, they can be used. But right now what we can use is the herbs that are actually working as antivirals. So we can we can have some herbs that boost our immunity, some that boost our Agni, some that can reduce the arm, some that can improve the digestion and metabolism and the overall health. So we can have various classification of herbs. Now, the one that are actual antiviral, I can list, I can give you a few names. One of them is we can use ashwagandha, we can use bhallatak, we can use bhumi amlaki, we can use shunthi, which is dry ginger, neem, licorice. We can use amalaki, chiraita, garlic, kutki. Lot of these can work as an antiviral. Haridra, which is turmeric, a lot of people take that. Then there is triphala, and there is actually a compound called sukshma triphala, though it is herbomineral. It has shown in clinical trials wonderful antiviral activity in HIV patients. So there are many such formulations that can be used in practical aspect.
So now,
Also
are these formulations used as teas? Are they used as powders? Are they used as tablets? And when do we have them? Is it between meals, or is it with the meal? What would you recommend?
So the single herbs that we can use in the form of teas or powders or even as pills, they can be taken as recommendation of the Ayurveda practitioners. We have hundreds of Ayurveda practitioners in the United States, pretty much in every state, which can be of great help during this crisis. Some herbs that are given for activating your digestive fire and to boost up your overall digestion and elimination, those are generally given before the food and after the food. The ones which are for boosting immunity, they can be given in the morning and at night. And we can also have certain things that you can cook your food with. So if you use ginger, garlic, turmeric, cinnamon, mustard seeds, a lot of these cumin, they can also have healing qualities delivered through the food. And
are they all for all three doshic? Meaning, are they for everybody? Some people can have more
some
fire,
yes,
some have more kapha, some have more, vata. So
right. So some of them are good for everybody, like the cooking spices and herbs. They can definitely be good for everybody to use them in the form of tea. So you can make a tea with ginger, with some mint leaves, with some holy basil, which is very good, and turmeric. And that can be taken on a everyday basis. And this doesn't have to be for specific dosha. It can be taken by everyone.
I see. But some of them are available in the United States, like
Yes.
plus all the spices are available. But what about like herbs like abrak bhasma or sudarshan or neem or
Yeah, so the Sudarshan Vati without any metals or minerals in it is available. That can also be given. And then there are single herbs like Guduchi that can be given therapeutically. Guduchi, Ashwagandha, Amalaki, they can be given or recommended by the Ayurveda practitioners. And as we know that COVID-19 is showing variety of symptoms, from fever, very high grade fever, to dry cough, to diarrhea, to some blisters on the toes, to lack of sensation of smell and taste. So there are like multiple symptoms, and a lot of people also are asymptomatic. So based on that analysis, the practitioner can guide what set of herbs will be good for what person to take. We have also some herbs that can help you to alleviate your symptoms. Like if somebody has very dry productive or productive cough, then we can give Sitopaladi churna with honey, or roasted garlic and honey. And there is Vasavaleha. So some of these can be given based on the specific symptoms of the patient.
I see, and I know that there was some clinical trials done. Actually, one clinical trial done in February, end of February, for 25 days in the United Kingdom. People who had COVID-19, but in the early stages with no comorbidities, meaning no other pre-existing conditions, and they found that this, and they were in self-isolation, so they were not in the hospital. They were isolated for 7 days, and they did this clinical trial. The results haven't come out yet, but I think we need more clinical trials with more participants so that people do understand the efficacy of drugs from the Ayurveda perspective, the antiviral drugs that you mentioned, whether it's Gaduchi or Neem or Sudarshan or Abhragvasma, all of them,
Right.
so that we have
Yeah.
a better hold on this, and we can say, well, this is evidence proven.
Yes, so actually right now many people are using Guduchi, Amalaki, Haridra, I mean turmeric, holy basil. Lot of these are even Bilwa. They are actually are being used not just clinical trials, but also for people who are not as seriously ill as go to the hospital. So at home they are taking these treatments from Ayurvedic doctors, and many people in India actually, through the government and through the Ministry of Ayush, there are a lot of protocols state by state that have been recommended, which contain these specific herbs: the Guduchi, Tulsi, Bale or Bilwa, Amalaki, Vasa, and Ashwagandha.
I see. I see. And then when we're recommending preventative measures for immunity boosting and for Agni building, which you talked about earlier, that you have low Agni, then you have problems.
Yes.
So we need to have a healthy lifestyle throughout, not just at the time of a pandemic, so that immune system is strong and resistant to the virus.
Right. So this is something, a lesson that we learn as we move out of this crisis. We still need to continue some healthy hygiene habits, sanitization, to take care of not just ourselves, but even our surroundings. And also to do certain rituals like, you know, something that we can help to create like a community awareness. So something like just planting some trees to give more greener and cleaner atmosphere for our future generations. Also, some personal things that we can do is periodic cleansing. If we just have like a protocol to do at every seasonal change or every month or every 2 months, it will really help to get rid of so many toxins that we accumulate in our body unknowingly, and we can stay away from harm, and we can keep our Ojas and Agni always strong. So even when we don't have this kind of epidemic or viral invasions, we still can remain very healthy and strong, even for other metabolic problems, because this is a very a natural situation. But then a lot of people suffer from their own misconceptions about food, about lifestyle, and we can also save a lot of people from diabetes, hypertension, cholesterol, obesity, different kinds of allergies and autoimmune conditions. So Ayurveda can be of help in many different ways.
Now, we did talk about the basmas, and since they are not FDA approved, there's another way Ayurveda practitioners do that is, whether it's cold water or silver water that helps to build the
Yes.
immunity, or pearl water. So share with us how to work on that area. So because that is, you can just sit at home and put it in the boiling water, the gold or the pearl, so let us know how we can do that.
Yeah, so because we cannot really use the precious metals and gemstones in a bhasma form for medicinal uses, we can still make use of those wonderful qualities that these precious elements in the from the earth that can give us. We can use gold as gold infused water. We can use copper water. So for copper water, we can just take copper container, pour water, clean water in it, drinkable water, and cover it, keep it overnight. Next morning, empty stomach, you can drink that water. That is very good for your liver, for your cardiovascular system, for your heart, for your cholesterol. Then for also for circulation, a lot of people have edema and swellings, inflammation, so that is really good. Then for gold infused water, water, which really builds up the Ojas, takes care of a lot of internal autoimmune conditions, skin conditions, and really builds up even the mental strength. That gold infused water, for that simple, you can take hot boiling water, pour it in a glass container, and put a gold nugget, a 24 karat pure gold nugget, 1 gram, 2 gram, 5 gram, whatever you can have, and just let it sit in the water all the time and drink the water from it. So every
Hot
time the
water?
water goes down, you can just pour boiling water in it.
So is it hot water you're drinking, or is it lukewarm water?
Yes. So in this particular COVID-19 times of pandemic, it is better to drink hot water, because hot water will help to keep the body and the system clean. It will get rid of the harm. And even in general, it is always a very healthy and a good idea to have warm water or hot water, nothing refrigerated or very cold, because that blocks all the pathways, that just douses the fire. So one of the principle we always have to maintain is keep a good digestive and metabolic fire, and not just the physical fire for digestion, but also the mental fire, which is all about creativity, enthusiasm, optimism. So that's what is also very important in the society right now. A lot of people are getting very depressed and fearful because of the media, whatever we hear and whatever we know about so many deaths with COVID, and we are restricted sitting at home. We can't really get out and do all the fun activities that we were used to do. So it's something very important to engage yourself into all positive things that you can. Maybe share all your wonderful things, memories with your friends through this Zoom or other social media. You can also do some chanting or spiritual, discussions. You can do meditation, you can do pranayama. There are a lot of group yoga sessions and meditation sessions actually happening online. So that's another one way to keep the mind peaceful and calm. And you can also do a lot of I've been seeing a lot of like competitions that we would generally do outside, but now you can do it online. The cooking competition or different classes about music and Zumba dancing and all kinds of things. So it's better to keep one engaged, because that also helps to boost our Ojas and our immunity. So if we keep ourselves very secluded, that's not going to help. At home also, you can do a little fire with a small, you can of course light some nice herbal candles, or you can have a small bowl of metal or earthenware, and you can burn some incense in it. The medicinal incense would be ajwain or neem leaves or holy basil, some camphor. Camphor is really good for purifying and improving the quality of air in the house. There are also indoor plants like money plant and snake plant that are very good to keep the indoor atmosphere very clean and purified. So some of these things we can definitely start incorporating.
So when you talk about do we like this ajwain and turmeric and camphor and basil leaves and put them in a corner, or you just leave them and just inhale the?
Yeah, or you don't want the sound, the fire alarm to get activated. So it should be done in a very small quantity in the corner of your room. It's like fumigation. Or you can also use a home humidifier, and you can put some essential oils in there that are really good. You can buy
Tea
camphor
tree
oil,
oil
ginger
or
oil,
eucalyptus,
tea
peppermint.
tree, yes, peppermint, any citrus oil, any citronella, tea tree oil, all these oils, even camphor oil is available. So all these can be used to purify the internal atmosphere. And then all other recommended hygiene protocol about sanitization and making sure that you don't contaminate your home and your surroundings. All those have to be followed as well.
Yeah, I think you talked about the anxiety, the concern, the panic, or because of the information overload that we're getting every day, and
Right.
everything gets evolved. How this virus looks like, and because the research is being done as we speak. So I think that also creates this kind of it's a fear of the unknown. We don't know you expect
Right.
until we get the vaccine, or we don't have a proper cure for it. But
Mm.
Ayurveda's perspective is for prevention. Once you have full blown, COVID, it's a little difficult at that time with Ayurveda, but maybe they can still work as an adjunct therapy, you think?
Yes, so we can always, even if the person is hospitalized, he will still eat something. So it's better to eat something healthy, like a moong soup or simple warm soups with vegetables and herbs, because instead of taking any other hospital food, this will always be very helpful in drinking teas made with ginger, turmeric, basil, cinnamon. All these things will be definitely helpful. And even if the vaccine is invented, the mutant, I mean, the COVID-19 virus has shown such aggressive mutation, and it's such a vast contagion that we still need to, we can't keep on taking and modifying vaccines all the time. We still need to work on our basic health and basic immune system to remain strong. And as we always say, it's survival of the fittest. So we need to remain fit and strong against any invasion that comes to our body.
When we look at a COVID-19 patient, and you are specializing in pulse diagnosis and tongue
Mm.
diagnosis, that's what Ayurveda practitioners look at. What do you see when you're looking at the pulse and also the tongue? How does it look like in a COVID-19 patient?
Well, based on all the symptoms that I know about COVID-19 patient, I can draw some inferences. Personally, I haven't encountered a COVID positive in my practice, and right now I'm doing most of the consultations on the phone and on the Zoom. So basically, whenever there is a depletion of Ojas and very depleted Agni and high incidence of Am, what we see is a very coated tongue. So even when somebody has a very high fever symptom, the tongue will be coated. The throat will be very dry and parched and irritated. So there will be redness, and those signs will be seen too. The pulse most likely is going to be, as I said, I haven't checked the pulse because I'm doing long distance consultations, but looking at the symptomatology and where the virus is really attacking, the pulse rate has to be very high, which is generally there in febrile conditions, as well as there will be a vata and pitta kind of elevation looking at most of the people's symptoms.
I see. And then in terms of vitamins, vitamin D, vitamin C.
Yeah, so there's a lot of talk about zinc and vitamin D and like a lot of vitamin C that people should take for prophylactic purposes. So you can also have those things from the fruits and vegetables and your daily diet. Sesame seeds, ragi, these things have very high calcium and iron in it, so those can also be added. Then you can get the vitamin D can come through just directly exposing to fresh air, sunlight, but make sure that you maintain social distancing if you go on the beach or go for a walk. And then the vitamin C comes from so many sources of fresh fruits that we have in season right now. Blueberries, oranges, lemons, mangoes are coming. A lot of these things will also help us. Strawberries, they will give us a lot of these antioxidants and something that helps for the cell itself, because the attack is on the cell. So we need to make sure that the Agni at the cellular level or the function of an individual cell in the body is really fortified and strong.
You
So that
mentioned, yeah, you mentioned about ama, the toxins inside us, and some could be environmental, some could be internal toxins. You need to detox yourself as the season changes, so that our system is strong. Because we're clogged up with the toxins, it gets very difficult to absorb and get the nourishment from a proper healthy diet.
Right. So what is generally recommended to do at home if you just want to do like a home fasting of 2 to 3 days, or if you can, if you have a good, strong mental constitution, you can also do it for 5 to 6 days at the most. But the fasting means you have to continuously drink hot water and herb teas which are cleansing, like turmeric, ginger, cinnamon, holy basil. Those teas can, along with some honey, you can add. And then only for lunch and dinner, you can have a bowl of soup. So it has to be really very light diet. So that's kind of fasting you can do for a week or less than a week, 3-4 days. And then at the end of that fasting, you're going to take a spoonful of castor oil. Castor oil is a very strong purging substance. So it will help to clean everything, to rebuild your Agni, and then you can be ready to take or handle all the climatic change.
Instead of castor oil, what will be a good substitute?
You can use Triphala. You can also use the smooth move like Senna tea bags. So any of these things can be used. But if you do this prior to the season, like right at the junction of one season to the next, you can definitely be safe from any imbalances the next season is going to bring into the body.
Thank you very much, Dr. Aparna Bapat, who's at iraspirit.com, and she's in Citrus Hills, Florida, and telling us all about how we can, with early intervention and prevention, can help to boost our immune system, our Agni or our fire, and with a healthy, nutritious lifestyle, and most importantly, staying healthy mentally as well, emotionally, psychologically, with meditation and having a more holistic lifestyle. It really helps to build up the immune system, and having healthy thoughts, good thoughts, thoughts for good for everybody around. Because that's in Ayurveda always talks about that. We are all one family, and we should have good, healthy thoughts for everyone, and that also helps us to build a strong, healthy
community.
Yes, absolutely. So thank you once again, Dr. Bapat, and hopefully we'll have you back again, talk about some more preventative measures for other illnesses. But right now, COVID-19 is what's consuming us, and we wanted to share with our viewers on TV Asia and social media about Dr. Bapat's perspective from the Ayurveda lens. I'm Dr. Renee Mehrra. Thank you so much for joining us.
Thank you.